Hi, my name is Aisha. My topic today is adapting palliative care delivery during the COVID-19 pandemic. The COVID-19 pandemic is also known as the coronavirus pandemic and is a global pandemic of coronavirus disease 2019 caused by severe acute respiratory syndrome, coronavirus 2, SARS-2. The virus was first found in China, the city of Wuhan, in December 2019. Attempts were made to contain the virus, but in vain. So it spread in Asia and then all over the world. The symptoms of the disease can be undetectable and deadly. The most common symptoms are fever, fatigue, and dry cough. The elderly patients and children are more easily affected. It is easily spread when people are together closely. As we all know, the virus tends to mutate, so does the culprit COVID-19 strains. It came in different forms and names such as Alpha, Beta, Delta, and Omicron. While those viruses were causing havoc in the world, the scientists were having a hard time to fabricate and combat a vaccine that can combat these strains. After a lot of hit and trials, the proper vaccine came into existence. The vaccine came in different names as AstraZeneca, Pfizer, Moderna, Novavax. It was obligatory to get vaccinated. Now let's see what palliative care nurses had to deal with during the pandemic to provide safe palliative care. The most important role was about personal protective equipment, for example, gloves, gowns, N95, masks, shields, and goggles. Sometimes one must consider vaccinating people with chronic medical condition as it can save them from serious illnesses. However, there should be consent from a family member or a carer. The nurses should assure that the family member and carer are also vaccinated. Nurses face many ethical challenges during the pandemic of COVID-19. For example, nurses' safety, role, and moral distress. Particularly nurses as the frontline workers caring for COVID-19 patients face a big challenge as they had no proper preparation for the pandemic and little resources and equipment. They suffered from a load of extra work as it was difficult for them to cope with the situation. This affected their relationship with patients and families. They were constantly worried as there was not enough information about the pandemic. Lack of nurses to work overtime and frequent shifts had put more pressure on the nurses to care for COVID-19 patients as well. After understanding the virus and having its vaccine available in hospital and pharmacies, it helped to reduce the fear of being infected of oneself and one's family. During COVID-19 pandemic, it was very important to communicate in delivering palliative care and advanced care planning. It was an unusual experience of grief. So much support was needed as there was a limit in physical contact. Families were not allowed to visit. This was very delicate condition and required a lot of techniques and proper communication to make family members and people understand. However, the use of technology came in handy communicating with family members and loved ones, saying goodbye over phone and video calling. To cope effectively in that situation, it was necessary to have communication and advanced care planning and provide self-care and be well prepared to address all of these challenges that was emerging at this time. Thank you for listening to me.